Systemic lupus erythematosus, referred to as SLE or lupus, is a chronic, long-term, illness of the immune system that is incurable and causes inflammation and pain all over the body. This disease occurs when your body's immune system attacks your own tissues and organs, thus referring to autoimmune disease. Inflammation caused by lupus can affect many different body systems, including your joints, skin, kidneys, blood cells, brain, heart and lungs. Because lupus affects many parts of the body, it can cause a lot of different symptoms. No two cases of lupus are exactly alike. Signs and symptoms may appear suddenly or develop slowly, may be mild or severe, and may be temporary or permanent. Most people with lupus have mild disease identified by episodes, called flares, when signs and symptoms get worse for a while, then improve or even disappear completely for a time. You will experience different signs and symptoms of lupus depending on which body systems are affected by the disease during the course of the disease. The most common signs and symptoms include 1. Fatigue. 2. Joint pain and swelling. 3. Butterfly-shaped rashes on the face. But also rashes can appear on hands and wrists. 4. Short of breath. 5. Chest pain. 6. Headache, confusion, memory loss. Who is at risk for developing lupus? Anyone can develop lupus, but certain people are at higher risk for lupus, including 1. 90% cases of lupus occur in women. Women between the ages of 15 and 44 are most likely to suffer from this condition. In spite of this, people of any age can also be affected by this condition. 2. Lupus is more common in African Americans, Hispanics and Asian. What are the complications which can associate with lupus? Inflammation caused by lupus can affect many areas of your body, including your 1. Kidneys. As a result of lupus, it is possible to suffer from serious kidney damage and kidney failure, and it is one of the most common cause of death for people with lupus. 2. Brain and central nervous system. If your brain is affected by this disease, you may experience many symptoms associated with lupus, such as headaches, dizziness, change in behavior, vision problems, strokes, and seizures. Among others, people with lupus often experience memory problems and may struggle to express their thoughts clearly due to the occurrence of lupus. 3. Blood and blood vessels. Lupus can contribute to a number of blood problems, including a decreased number of healthy red blood cells, anemia, as well as a higher risk of bleeding or blood clots. It can also cause inflammation of the blood vessels. 4. Lungs. Having lupus increases your chances of developing an inflammation of the chest cavity lining, which can make breathing painful. Bleeding into lungs and pneumonia also are possible. 5. Heart. Lupus can cause inflammation of your heart muscle, your arteries or heart membrane. The risk of cardiovascular disease and heart attacks increases greatly as well. Managing symptoms. Lupus is a lifelong condition, but with proper support from healthcare professionals, friends and family, it is possible to effectively manage the condition. Now let's look at how lupus is treated. There is currently no cure for SLE, but there are different medications that can help relieve many of the symptoms and reduce the chances of organ damage. These medications include 1. Hydroxychloroquine. These drugs were initially used to treat and prevent malaria. But from 1955 HCQ was shown to be effective for both systemic lupus and rheumatoid arthritis. Research into the wide-ranging effects of hydroxychloroquine has revealed many important benefits in the treatment of lupus, such as decreases in the number of disease flares and damage from disease over time. 2. Corticosteroids, anti-inflammatory medications. These medications are used to suppress your immune system to calm the inflammation. Corticosteroids, sometimes called simply steroids, usually work quickly to relieve pain, rashes, and swelling caused by lupus. 3. Immunosuppressants. Drugs that suppress the immune system may be helpful in serious cases of lupus. Examples include azathioprine, mycophenolate, methotrexate, cyclosporine and leflunomide. However, these drugs can cause side effects, and potential side effects may include an increased risk of infection, liver damage, decreased fertility, and an increased risk of cancer. That's all for today. If you find our video useful, don't forget to subscribe to our channel to get updates for new videos. Next week we are going to discuss natural home remedies that may help to decrease flares of lupus. Thank you for watching and see you next time.